Welcome to Behind the Mask, episode 4, where real plastic surgery experts break down real-life cases from the most bizarre to the hottest trends. We're going to take you behind the mask to get unfiltered analysis from our true experts. I'm your co-host, Dr. Bill Adams, with my co-host and world-renowned plastic surgeon, Dr. Jason Posner, who's actually in studio at this
and we are live. See, we are live.
Full throttle. And of course, we have our special guest expert and Dallas plastic surgery consultant and Sports Illustrated swimsuit model,
I was waiting.
Khloe Kardashian. So let's get right into it. Okay, our first clip today, it comes from an episode of none other than Botched, where a patient suffers from brain leakage.
We have to make sure that Lucy is not draining fluid from her brain out through her nose.
I was in a motorcycle accident in Italy 15 years ago. I had no helmet on. Got cut off, went over the handlebars and hit a cobblestone wall. I was cut from here down, and this was completely severed in two. So about a week later, I fly home, and I go to my doctor, and they seem to think everything was basically set. So just gonna leave it alone. They took the stitches out. As time went by, it started to like cave down here. And you can see it getting worse through the years.
You know, it sounds like you had an undiagnosed facial fracture that wasn't set, because a mid-face fracture, although will look okay in the beginning, will start to cave in over the years.
Sometimes when I bend over, clear liquid comes out.
Oh, really? Do you still have that leakage now?
I had it today.
When we hear clear fluid leaking, we think of something called CSF, cerebral spinal fluid leaking out of her nose. Basically, that's fluid from her brain. Is it just like clear liquid that comes
Clear
out?
liquid, it looks like water come out of my nose. There's no warning, and it comes out, shoots out, just falls out.
Where do we go from there?
You know, that's a complex problem, and that patient needs that's not an easy problem. Why is this on Botched stuff?
No, but that's exactly what the other guy, clear. I mean, it's like a saddle nose deformity from a nasal fracture, not like undiagnosed facial fracture. You know, come on.
Why is this on Botched? It's not a botched surgery. I mean, she had an accident. She
Right.
needs a workup. They need to do CAT scans and MRIs to see what's going on.
They're
with
running
that.
out of content.
Yeah, I mean, it's crazy. You know, to me, like, this needs the person who should be doing this is someone who's very skilled in facial fractures and to reconstruct this nose.
It's actually more specific, you know, rhinoplasty. This is a post-traumatic rhinoplasty. But, you know, I mean, basically, it's standard principles. You're gonna open the nose. You're gonna probably need a rib graft in order to build up the dorsum. The issue is that, you know, they're talking about that CSF leak, and that's a whole nother thing. That may need to be, if she had a CSF leak, that's probably not something that any of those guys or any of us are going to deal with. We're probably going to need to get a neurosurgeon involved.
Or an ENT who does these. I mean, they patch them. But what I don't understand is that what they even talk about is this fracture happened a while ago. People don't have CSF leaks for years because it gets infected and you get brain infection.
I mean, I just feel like also she's been through enough trauma for the whole incident, and then when they bring her into the room and then just basically tell her that she doesn't have a good shot at fixing it, I don't think that was the proper way to...
She's got that Boston accent, man. You got to do something for her. All right, let's go on to the next one. Our next topic comes from an article from The Sun, which discusses the latest, believe it or not, guess who? Kardashian controversy. Khloe Kardashian is being blasted apparently for botched lips, an unrecognizable face after recent plastic surgery allegations. What's the deal here?
First of all, I think she's clearly had a lot of work done. My thing with the Kardashians and with just pop culture in general, celebrities, is that they love to get a lot of work done and then deny that they've had it done when clearly, you know, you can see the before and after. So, I mean, she has a new face. I think she should just own it. It's a completely new face.
Look, if you're going to say analyze her lips from a plastic surgery perspective, she has too much filler in her upper lip. It's turned up. It looks weird, right? You would look at it and go, "That's a weird looking lip," right?
Mm-hmm. I'd say quack.
So what do you do? This patient comes in with this. You said says you had some filler. First thing I do is reach for my hyaluronidase, dissolve the filler in, let it dissolve a bit, and then start again.
You see this in different things, but it's like just because you fill something out or make it bigger doesn't make it look better per se. And like if you want a pretty lip, like I mean, look, Ellery, you have nice shaped, full lips, but they're not huge. And if you made your lips bigger, they probably look a lot worse. So, all right, let's go on to the next case. Ellery, give us a drum roll because this is another case brought to us by Dr. Jason Posner, who's in studio with us. So Jason, lead us on to this here.
This is Jason's daily practice, messed up boobs. Okay, so typical case comes to your practice, you look at this, okay, she's got, what does she have?
Capsular.
And you can see that from like a mile away, right? She got a right contracted breast and the left one doesn't look so bad. Okay, so these are some of the problems that we address pretty routinely in our practice. But what's interesting is, like, I look at this and I go, yeah, you can fix it, but how do you keep that fixed? That's the key to this. How do you prevent the recurrence of the capsular contracture? So my protocol for this is complete capsulectomy. Okay, wash with triple antibiotic solution, and don't kill me, but I also use hypochlorous acid in the 2-stage approach because I like to wear a belt and suspenders, but I do both. You can yell at me about that. I send the capsule to Microgen for DNA testing to figure out what bacteria is in it. And in these cases, I use Stratus for support and to help prevent recurrence. We talked a little bit earlier about perhaps using P4HB instead of Stratus, but this is the key is that we do this on a routine basis. So this is a case that we look at and we're like, okay, it's a capsule case. And what's your approach to this?
What I'd add is, like, what's really important about this is that this can be prevented, largely prevented, and you prevent it with good technique, 14-point plan, things that we've been talking about for 20 years. Jason and I know it well, but most of these things, particularly, and although I do exactly what you do, Jason, in terms of correcting something like this, and we can do it with good success, but it can be difficult, and there are issues that these people have. Sometimes they can have atrophy, they can have skin looseness, they can have sensory changes, they can have recurrence. So it's just not, hey, if I got this, it's no big deal. It's better not to get it in the first place.
So Bill, let's comment on this. Bill is single-handedly, I'm going to give you some kudos for this. You are single-handedly responsible for reducing the capsular contracture rate around the world. I think your publications and teaching has reduced that. But you still see patients like that. As a matter of fact, I saw a patient this week that I operated on. I did bilateral capsulectomy with Stratus placement, right? Her previous capsulectomy had bilateral pneumothoraxes. So it was, I was like really careful. I was fine, no problems, but she had bilateral pneumos from the attempted previous repair.
Yeah.
Scary.
Yeah. It is, and sometimes the best defense is a good offense, and so that's what we say, kind of do these things, really try to prevent this. But if you do get it, it's not the end of the world. There are good things that we can do.
I think that it's crazy how common capsular contracture is, and how sometimes, low percentage with doctors like y'all, it is preventable. But I think the first time that I saw it, I was like, yeah, aliens are real.
Yeah.
It's
look like
crazy. They have a mind of its own.
I call them dinosaur eggs.
It's like full-on Space Jam.
Well, you pull them out on the back table and they look like dinosaur eggs.
Yeah.
That's what they look like. And sometimes they're really calcified and they really look like they came from another millennia.
But the sad part is that if you're going to fix it, if you go to the improper surgeon, we see a lot of revision patients in our office, and it's like, you're not even fixing it. Your implant's too big, and over time, it's going to get worse, thin out the skin, and so then it gets even more alien-like. So I think the important thing is choosing the right surgeon and the right implant size. It's a big part of it.
I think that definitely helps.
It's good stuff. All right, well, thanks for joining us this week on Behind the Mask. You can find us on our YouTube channel or theplasticsurgerychannel.com. For Dr. Jason Posner and Ellie Milliger, I'm Dr. Bill Adams. Until next time.